Hi, it's Dr. David Greene, founder and CEO of R3 Stem Cell. Today I want to talk to you about the pain that often occurs after a bone marrow stem cell procedure. With a bone marrow stem cell procedure, you are the biological donor. The tissue comes from your bone marrow. Predominantly, it's produced in your pelvis. Okay? So the top part of your pelvis is called the iliac crest, and that's where the big fat needle is put in to aspirate the bone marrow. When I was in residency, we actually did a study looking at what do you get when you put the big fat needle into the iliac crest and you aspirate from it. Well, what you aspirate is about 60 cc's. So a big syringe of bone marrow that you aspirate. Well, what we found is that you get the first few cc's, you get a decent amount of stem cells and other regenerative elements. The rest of it, the other 58 cc's or whatnot, is mostly just blood, which is not helping when you're doing a regenerative procedure, okay? So what we started doing, and which is what most people around the country will do, is they'll take this big fat needle, they'll sort of numb up the area over your pelvis, and then stick it in, hammer it in, pull a little bit of bone marrow out, and then take the needle out, move it, put it back in, take a little more out, take it out, move it, put it back in. So what you end up with is a Swiss cheese phenomenon that increases the percentage of chronic pain after a bone marrow procedure to over 40%. When you couple that with the fact that over the age of 50, you lose well over 90% of the regenerative cells that we had when we were born, you have a numbers game that is working well against you. The pain and the lack of cells means that anybody over the age of 50 should not have a bone marrow stem cell procedure. There is no statistics that back up those numbers from your bone marrow that are anywhere close to what you can obtain with umbilical or amniotic tissue when it comes to the regenerative cell counts. They can't. So if you are 50 or over and contemplating having a bone marrow stem cell procedure, think again and then think again, okay? Because with over a 40% chance of chronic pain in your pelvis from the aspiration and then the lack of cell counts as we age, it's not worth it. Visit us today at r3stemcell.com. You can find the providers there. We have over 30 centers nationwide offering first-rate regenerative procedures. Or simply call us at 844-GET-STEM and we'll get you squared away. Thank you.